Hello again, everyone, and welcome to another episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and joining me on the podcast today is Dr. Nafysa Parpia. She is a fellow naturopathic doctor here in our great state of California, and I know you've been practicing a long time with your partner, Dr. Eric Gordon, who's a medical doctor up at Gordon Medical, and you are the director of naturopathic medicine there. And I love it that you and I have very similar practices. We see a lot of Lyme disease, environmental illness, mold illness, chronic disease. So, Dr. Nafysa, welcome to the show.
Thank you. Thank you for having me. We're going to have such a fun conversation because we practice so similarly. So I'm really excited.
You know, this is allergy season. I'm sure you're seeing a lot in your practice too. You know, people with chronic nasal stuff, sinus stuff, congestion, drippy stuff. And I want to talk a little bit today about kind of the importance of our sinuses and how they impact our overall health, because I think it's one of these areas of our body we kind of don't really think too much about. And if you're not someone who necessarily gets run-of-the-mill hay fever, you may not really think much about how your sinuses and the collective microbiome might be impacting, your overall health. Can you tell us a little bit about the microbiome of the sinuses? I think we talk so much about gut microbiome. We forget that other tissues have a microbiome.
Right. I think this is really important, and it's such an underappreciated topic. People aren't thinking enough about it. You and I are. So I'm so glad we're having this conversation to just bring it out into the public. Everybody knows about the gut microbiome and the connection between the gut and the brain. And there's a sinus microbiome, and I think it's very, very similar to the gut microbiome in many, many areas. So first of all, just like the gut, we can have dysbiosis, more pathogenic bacteria than beneficial bacteria. We can have the same thing happen in our sinuses. And just like the pathogenic microbes in the gut can create neurotoxins and biotoxins that then cross the blood-brain barrier via this highway of nerves that we have from the gut to the brain, the same thing can happen in the sinuses. We can have pathogenic microbes in the sinuses that can cross the blood-brain barrier as well through some nerves, which we can talk about after. And not only that, but our bodies create inflammatory chemicals in response to having infections, microbes. So that can happen from the gut to the brain and as well from the sinuses to the brain. So there's so many parallels here, from the dysbiosis to the inflammatory cytokines we create as a response to those microbes to the toxins that the microbes create. So in a way, I think that the sinus microbiome is just as important as the gut microbiome when it comes to brain health.
Yeah, I think about this time of year, I see so many of my patients using different like nasal sprays to help kind of control their allergies. And I wonder how much, I think of something like, Flonase, a nasal steroid, how much of these nasal medicines are potentially negatively impacting our nasal microbiome.
I bet you they are, right? And it's interesting you say that, because I'm seeing, well, I'm going to backtrack a little bit, right? We can test not as sophisticated the nasal microbiome as we can the gut, right? But I am testing, as I know you are too, the microbes in the sinuses, because we can do that now. In the gut, we can look for inflammatory markers, and we can look for the beneficial bacteria. It's not as sophisticated in the microbiome. The testing isn't as sophisticated, but at least we can test for the different kinds of bugs that are in there. And I sure do see a lot of them. And, maybe some of that is related to the amount of Flonase and other chemicals that are being used that could be disrupting the microbiome. Absolutely.
Well, much like the gut, the microbiome in the nasal passages is very diverse. And again, there's bacteria, there's yeast, there's, all these little critters that normally live there. It's interesting. I remember reading a study many years ago that over half of chronic sinusitis was actually fungal, not bacterial. And we see all these people with chronic sinus infections that keep getting antibiotic after antibiotic, which of course is going to disrupt the microbiome across the whole body. And yet it's really treating the wrong thing.
Right.
And, a lot of doctors don't even think, even some of the ENT doctors, and again, yeast can be hard to culture. And if you're not looking for it, if you're just doing a regular bacterial culture, you're not even looking for yeast. And sometimes the nasal passages get so swollen, we can't at least easily isolate yeast if it is there because it's kind of high up there. But it's just interesting that, this shift in these bugs, much like the gut, really have this long-term negative impact in the sinuses.
They really do. And it's so true that it's missed, right? How many patients do you have who've gone to the ENT, who've gone to multiple ENTs, then they've got surgeries done, right? Thinking that that's going to help them, but it didn't help. Sometimes the surgeries even backfired. And I asked, did the ENT do a swab for you? No. Like sometimes they did, but usually no. And we're finding lately, I'm finding multiple different types of funguses up in the sinuses as well. And I'd say even post-pandemic, I'm seeing this more. Prior to the pandemic, I would maybe find marcons or one bacteria which is considered pathogenic. Now, post-pandemic, I'm seeing layer upon layer of different bugs in the sinuses of our patients. Different bacterias that I didn't see so often. I'm seeing Klebsiella more in the sinuses than I ever did before. And I'm seeing different funguses, even ones I'd never even heard of before or never seen before. And I think that has to do with masks, right? Like
Right.
we go out, get exposed, put the mask on, and the microbes, funguses get trapped in there. Or Eric, Dr. Gordon was thinking maybe it even had to do with the gut microbiome, right? That people we're breathing everything in. And actually, I am seeing similar bacteria in the gut to the sinuses in a lot of people as well.
Yeah, Klebsiella is generally a gut microbe, not a sinus microbe. And same thing, I've seen similar things, and something like Klebsiella pneumoniae, which is a very common bug in the gut. It's a very biofilm-rich producing bacteria. I was a clinical microbiologist before I was a doctor, and you could always tell Klebsiella in the lab. You would pull the plate out of the incubator, and the whole bottom of the plate, you turn plates upside down when you incubate them, the whole bottom of the plate would be filled with biofilm. It looks like someone blew their nose on the plate. So you can imagine if you got a very biofilm-rich bacteria, we know what it does in the gut. We can imagine what it does to the sinuses, right? It's just creating
Right.
more and more mucus and gunk and inflammation. And again, it's surprising that we're seeing these kind of things. And I think you're right. I think, the mask over the last several years has been a big contributor because I don't know about you. I saw these people driving down the street hanging their surgical mask or cloth mask from their rear view mirror. Certainly a cloth mask if you never washed it. I mean, technically, if you were doing that, you should have been washing it every single day, which nobody did. Surgical masks were designed for single use. You wear it for a few hours, you throw it away, get a new one. I saw people wearing the same mask day, week, on and on. And no doubt it was contaminated, and you're just kind of reinfecting yourself with your own goo over
Yeah,
and
or
over.
patients who even will admit that, right? Well, I've been using the same mask. I'm like, you can't do that. You got to wash that thing
Oh,
or
I even saw family members sharing their mask.
oh,
Like it wasn't bad enough that you were wearing the same mask yourself over and over, and then let alone share it with somebody else, and now they're, getting contaminated with your own stuff. So uh, that I'm sure was a big part of it. But
yeah.
what is it that you're seeing in terms of, sinus health and how it's affecting brain health? You mentioned a little bit about this connection with the brain. Are you seeing it in terms of how it's affecting, memory, cognition, mood?
Absolutely, right? So people, well, our patients, maybe I'm going to explain to them a little about who our patients are because we see the same patient population. People who have multiple infections and they've got multi-systemic disease processes going on at the same time. And one of those processes is commonly chronic sinusitis, meaning inflammation in the sinuses for at least 3 months, usually 6 months and more, right? So this patient population typically has issues in the sinuses. And so what we're seeing is exactly what you just said, these issues in the brain. The patients think, and same with their doctors usually, yeah, you've got sinusitis because you've got blocked sinuses or you've got a runny nose. But what what often isn't considered as linked to this is the brain fog, sleep issues, hormonal issues, cognitive issues, mood issues. And then we see that after we treat the sinuses, these things begin to start to resolve. And the reason I say begin to start to resolve is because our patients have so much more going on. We have to treat multiple systems, but usually I'm treating the sinuses as one of the first things for these people who have chronic sinusitis, because it makes a huge difference. But I want to talk about a study that came out a couple of years ago at University of Washington, where they gave brain MRIs to people who have chronic sinusitis. And they looked at cerebral blood flow and neuronal activity. What was shown is that the people who had chronic sinusitis actually had more activity in the MRIs around certain areas like executive functioning, mood, sleep, integration of external stimuli, um, executive functioning. So all these symptoms that we see in our patients who have chronic sinusitis, it was finally proved on this research, which made me very happy, because the things that you and I are seeing around the sinuses, finally I could point to that article and say, look, this is real, right? Oh, and an interesting thing was that the degree of sinus inflammation matched the degree of activity on the MRIs around these areas.
Oh, interesting.
Yeah, yeah.
So for people who've maybe been struggling with chronic sinus issues, particularly, in and around the pandemic, what are your first steps of, how best to evaluate this? People may not have made the connection yet that, hey, I've had a chronic stuffy nose for a long time and I get sinus infections and I've been on antibiotics. What's kind of the first step of trying to evaluate what's going on in the sinuses?
So the first thing I'm doing, well, of course, if I'm doing a physical exam on the patient, evaluating their sinuses. I'm also looking in their ears a lot. A lot of the times they're talking about having issues in the ears. I'm also looking at the mouth. So I'm not looking only at the sinuses, but I'm looking at the surrounding areas, because I know there's a connection. And now, of course, I'm looking at the gut, because I'm seeing similar similar microbes in the gut. But in looking at the sinuses, I'm definitely doing a swab, either microgen. Oh, can I talk about labs in here?
Sure. Yeah, this podcast. You can talk about whatever you want. This
Okay.
isn't CME.
Okay, so I'm using, and probably you are too, Microgen or Microbiology
Yep.
DX. Are you using those labs as well?
Yep. Yep. We use
Like,
Microgen DX. You bet.
yeah, yeah. So I'm looking, I'm looking for bacteria, funguses, biofilm. And when someone has it severe, I'm actually using both labs, because sometimes the different ones will pick up different bugs. And I just want to get the whole spectrum that I can. And there's also a sensitivity report just for the patients who are listening today. We can tell what kind of antifungal or antibiotic your particular microbe might be susceptible to. So that's important to look at. And I'm also using Microgen labs to do an ear swab for certain people who might have issues in their ears as well. And often I'm finding the same bugs in the sinuses as in the ears, as in the gut. So that's why I think it's important to evaluate the microbiome in all the areas that we have access to evaluate that.
So, what do you think is underlying a lot of this sinus stuff? I have my own thoughts, but I'm curious what you're seeing in your patient population. What are really those underlying triggers?
For patients living in the Pacific Northwest and living in California, I think that the fire smoke has definitely
Yeah.
impacted that. I've seen a rise in sinus inflammation and bugs in the sinuses since there became a fire season in these areas, that's for sure, because the microparticles in the particulate matter in the smoke can definitely irritate the epithelium of the sinuses. And another thing, um, in common with the gut is that there's an epithelium, right? Meaning for our patients who are listening, they don't know what that is. That's just the cells that line the organs, right? So there's cells that line our sinuses, and particulate matter from smoke or other air pollution or from mold spores as well, they can irritate the epithelium. And there's a lot of inflammatory pathways in the sinus epithelium, actually, sorry, anti-inflammatory pathways in our sinus epithelium. So if that gets disturbed, that's going to be a causative factor as well. So I think it's from a lot of external things. I also think that it could be about things that are more internal going on as well. I think that there could be inflammation in our body, overall in our body, going on from the multiple issues that our patients have, multiple infections in different areas of the body, multiple environmental toxins, and that can be, it's really about what's causing inflammation in a patient and where their weak links are in their body. So there could be a gut relation. There could be allergy relations, of course. What do you think? I'm curious to hear what your thoughts are.
Yeah, I agree. I think with the allergy slash mast cell activation piece, which can be caused by a lot of things you just mentioned, that clear fluid that gets created from allergy is the perfect breeding ground for any microbe to take root. If you have a dry environment, it's very hard for certainly bacteria and even yeast to thrive. So if you can selectively starve it by cutting off that fluid production, we see this a lot like with our kids that get chronic ear infections. The reason they get chronic, ear infections is that they've got some element of allergy. The fluid builds up in their ear and then they get the infection. As soon as we stop the fluid production, the ear infections go away. So I
Right.
think it's the same kind of issue with sinuses. So yeah, I mean, if you get exposed to fire smoke, you get exposed to mold and mycotoxins, that can be a direct irritant to the tissue. That can cause inflammation. But I've seen people in my practice where they eat the wrong food. It's some element of food sensitivity that leads to that. They start getting a runny nose. My mother, for years, my gosh, every time she would eat tomatoes, within minutes her nose would start running. It was a direct effect of what the gut and the nose were kind of doing together. So even food slash gut reactions can potentially set off inflammation in your nose. I think we
Right.
always directly associate it with something you're breathing in, but it could be related to something you're ingesting as well.
Right, and this is the beauty of being naturopathic doctors. Nobody thinks like this, really. That we're trained to think like this, and that's why I love our medicine, right? Like, people think that that's far-fetched. Like, the gut isn't that far from the sinuses. How can it be? Shouldn't it only be something that's directly affecting our nose? But absolutely not, because our body is a whole, right? Our body, each system interacts with each other, and this is how we think. This is how we treat.
Well, I think it's been interesting with all the research on the vagus nerve, how, again, what goes on in the gut directly affects the vagus nerve. And there's a feedback through the vagus nerve, which, of course, is connected to all these other different tissues. So I think that's part of that mechanism. The reason that some people get migraines and some people get brain fog and some people get these other neurological symptoms, it can be a direct effect, what's happening in the gut through the vagus nerve.
Yes.
So it's not much of a stretch to kind of figure out the mechanism of why. It's just the best, what's the best way to treat it so that we can eventually get people to hum. So kind of diving into treatment, what are some of the ways that you help people get over this chronic sinus stuff?
Right. So one of the first things I'm doing is working on modulating their entire immune system, right? So I like to use peptide therapies for that. I find that that makes things go much faster when I'm modulating the immune system first, not for everybody, but for a lot of people. One thing I also want to mention is structural integrity
Mhm.
issues. I think this is a big deal. It's something that's overlooked, but a lot of the times our patients have issues in their neck. They might have tight tissues, stiff tissues. Well, that's blocking lymphatic flow. It's blocking circulation. So of course they're getting circulation. I'm not saying they're not, but it's not optimal. And we don't have an optimal circulation and lymphatic flow. Things get backed up, things get clogged. So um, we have some really good body workers that we use for our patients to help with those with structure integrity issues. That's a good starting point as well. as immune modulation. And then very often I'm working quite directly in the sinuses. And I do it very similarly as naturopathic and functional medicine doctors work with the gut. So I'm sure many people listening today have heard about the 4 R's of gut repair, right? Where it's remove, replace, reinoculate, and restore, right? And so I'm doing the same thing for the sinuses as the gut. And this is by no way in the box of medicine, right? This is naturopathic medicine. It's something I've had to think about a lot because my patients have had this issue. Over many years, I've been giving a lot of thought. So in the gut, the first thing I might be removing is inflammatory foods. I'm also doing that for people who have sinus issues because, like we were talking about earlier, the inflammatory foods can create overall inflammation that can then affect the sinuses. So removing the inflammatory foods in the gut, it would be to remove the pathogens. Well, it's the same thing for in the sinus microbiome. What I find on the sinus tests, if it's a pathogenic bacteria or fungus, I'm wanting to remove that. So I like to nebulize Argentine silver very often as a starting point. Sometimes people worry about that, but that brand of silver has been highly researched.
Yep.
And really, it is the Rolls Royce of silver. It's not going to build up in the body. It's not going to cause heavy metal toxicity. It's not going to cause anyone to turn blue. And then some patients say, I can make my own silver at home. I like, don't do that. Don't do that.
No, no.
That's going to cause you some issues. So I only recommend one type of silver. And I like to give patients the studies on that if they're curious about that, because that brand has done a lot of research on their product. So nebulizing the silver, or I'm nebulizing the antifungal or antibacterial that their microbes are susceptible to. Some patients want to just spray, right? But if we're spraying, it only goes up to here.
Right.
So it's more work to nebulize, but when we're nebulizing, it turns into a fine mist and it goes high up, which
Right.
is where the problems are, right? So then after I have done that, then I'm actually, I'm not going to say after, even before and during the whole process, I'm also lining with coconut oil. I consider that as a replace, right? In the gut, we're replacing the inflammatory foods with anti-inflammatory foods and the appropriate supplements. In the sinuses, I'm using coconut oil, and I learned this from a great ENT, a functional ENT, who taught me that if you line the sinuses with coconut oil first, we're then directly affecting that epithelium. He
Yep.
told me when the epithelium is dry, it's hard to get at those microbes. So I have my patients do that. They love it. I had a patient from Denmark actually who then he not only did he just line the sinuses, but then he lay back for 15, 20 minutes. I was like, I didn't tell you to do that, but I love that. And so now other patients are starting to do that. They love it. It brings down the inflammation. They feel better. Some people, that alone is the only thing they need. Not everybody, maybe 5% of the patients, that's all they need. And then there's the re-inoculation stage. So re-inoculation of the beneficial bacteria, probiotics for the gut, probiotics for the sinuses as well. There's a product called Nasal Biotex, and it's Lactobacillus sakei. And that is a probiotic which in the sinuses helps to kill pathogenic bacteria. So we're doing that. And then finally, in the repair stage, in the gut, we're repairing leaky gut. In the sinuses, I'm working to repair brain inflammation. So I'm using peptides, I'm using nootropics like C-Lank or C-Max or cerebrolysin or VIP nasal spray. But one thing that's important for people to know is that using these nootropics, especially the ones to spray in the sinuses, it's not going to work very well if you still have microbes up in there, the
Right.
pathogenic microbes. So that's how I treat.
Well, that's a great overview. And I love the fact, again, we've got so many different ways we can approach this. And the beauty of our medicine is that there often isn't right or wrong, it's just different. And there's so many different ways you can help people, get better health. And That's really what this podcast is all about. How do we make our body more resilient to these things? In our practice, we focus a little bit more on immunotherapy and trying to modulate the immune response to mold, to pollen, to dust, to food, to different pathogens. Because again, if these are constantly triggering inflammation, sometimes these other things just don't work as well. So again, we
Yes, I
still do a
love
lot
that
of the
you do
nasal
that.
stuff, and
Mhm.
so we've been doing sublingual immunotherapy and low dose allergy therapy for many years. And again, it's just I think one of the better ways we've found to help modulate the immune system in a way that hopefully permanently you get to a point where these things don't bother you anymore. I mean, I've had people that have had long-standing pollen allergy and dust allergy and cat allergy, and we can get people over the hump where they can be in these environments and they don't feel inflamed. They don't feel like their nose is constantly congested and runny and sinus pressure. But again, peptides, and we use a lot of Argentin 23. It works great. People tolerate it well. Again, we've got a lot of different great approaches. So it's just good to know out there that you've got different options. And if you're someone who's been really struggling with, chronic sinus stuff, and in particular, if you've been suffering, any kind of brain issue, neurological issue, it's a good idea to get in the hands of a good naturopathic doctor, functional medicine doctor who kind of really understands this, because we know how it is in the conventional medical world. It's often a prescription to help treat a very specific set of symptoms that don't necessarily get to the root of the underlying cause. And, I think we're a little bit more interested in trying to really figure out what's going on with every person.
That's right.
Well, I really appreciate you sharing all of your information and knowledge. I know it's really helpful for people. I also know you have a free gift you'd like to share with people, a pre-tox protocol. Can you tell us a little bit about that?
Yeah. So a lot of my patients, I know this is the same with you because we share such a similar patient. I haven't even talked to you about this, but I already know this happens in practice. You have patients coming to you and they've probably told you, I did a detox protocol and it backfired, right? Or I
Right.
never make me do that because it's horrible. Well, the reason is, and I know you know this, but just for our patients, it there's it can be the right medicine, but just at the wrong time, right? If somebody is constipated or if somebody has chronic bladder or urinary tract inflammation or infections, this is not the right time, for example, to be detoxifying them, because we need our organs of elimination, our gut, our liver, our skin, our kidneys to be strong, to be able to handle this load of toxins coming through as we flush the toxins out with detox therapies, right? So it's about preparing the body to be ready for detox so that it's actually a pleasant experience as opposed to unpleasant, but that so that it's effective. Because if we have our organs of elimination, uh, if they're blocked in some way, or if they're not healthy in some way, then detox is counterproductive and painful. So that's what this is about. How to prepare.
Great. Well, we'll drop a link in the show notes for people who want to check that out. And you and Dr. Eric Gordon are up in San Rafael, California. That's up near the Bay Area. If people are interested in working with you, where's the best place to find you?
So they can go to gordonmedical.com, and we have a new patient coordinator who fields all those calls, and then really we have an entire think tank, many doctors at our clinic, and so working with one of the doctors is like working with all of us because we all meet and discuss your cases. So it's very exciting.
Well, thank you again. I really appreciate you spending time with us on the podcast. And I know that people are really going to benefit from everything you've shared today. So again, thank you so much for joining us.
Thank you for having me.